Okay, good afternoon, everybody. So now we're coming to our afternoon session. Just a few instructions before we start. So for the next 2 hours, we're going to be moving on to a general session. And for the audience, we're going to have the questions from the floor after the third talk. So if I may ask the presenters, after they're done with their talk, please join me on the table. And after the third talk, we will have the questions from the floor. So, for the first lecture, or the first talk, going to be a consent and medical legal issues. And as you know, the Ministry of Health have issued a ministerial decision, which is Al-Qarar Al-Wazari, numbered 307/2015. For anyone who doesn't have that, I have it, to fully implement all the rules and regulations concerning obtaining a patient consent. Now, many patients can ask a lot of questions regarding a consent form. For example, what do we mean by an informed consent? Who is responsible in taking that decision? How much information we can give to the patient in order to obtain a consent? What is the validation of that consent? And last but not the least, what are the responsibilities of the medical team to ensure a consent is being taken appropriately? Now, all these issues will be discussed by our next speaker, and I have the pleasure to introduce to you. He's a graduate from RCSI, Dublin, Ireland. He's a consultant general surgeon at Mubarak Hospital. He's a fellow of the Royal College of Physicians in Edinburgh, Glasgow. He's a Kuwaiti Surgical Board certified. And in fact, he's the current program director for general surgery residency training program at KIMS. Please welcome with me Dr. Ali Ismail.
Thank you very much, Dr. Ibrahim, and thank you very much for inviting me for this conference. First, as Dr. Ibrahim said, that consent is very important documentation in the patient files, so that's why I will talk about it. So first, just an introduction that obtaining patient consent before provision of any medical care is the legal and ethical principle, and it reflects the patient right. If you don't take a consent from a patient, well, this will put you in the legal issues. So nothing for the patient called the minor procedure. Whatever you want to do for the patient is a major for him. But we are physician, we divide into minor and major. But for him, all the procedure are major procedure. Now we have 3 types of consent. Non-verbal, that's when you want to take a blood pressure or you want to withdraw blood. And then we have another 2 types, the verbal or the informed consent and the written documented consent. Now, the consent to be valid has to be follow a few points. The person should be well informed. The person must be fully mental capacity, therefore capable of understanding what you are saying, have the ability to understand and give you the appropriate decision, understand the consequences of accepting or not accepting the treatment, and he has to be of a legal age. Therefore, he has to be 21 years old in a fully calendar year. And the consent has to be taken with the full free will, without any pressure on the patient. So why the consent is important? Because things can go wrong during any kind of a procedure. So consent is important for the safety and satisfaction for both hospital and the patient. Also, it's part of the ethical standards. It's a legal requirement from the physician. It's also important for the accreditation standards and also reduce the litigation. Therefore, it will save time and money. So consent is very important documentation of the patient file. So who's responsible for informed consent? Who's doing the procedure? So either he's a surgeon, physician, intervention radiology, or even anesthesia. So if we take the physician, he can take the consent by himself or by his representative. But this need a criteria. So he has to be experienced physician, qualified, knowledgeable. He knows the risk and benefit of the procedure, and he is able to answer any question that the patient may have in his mind. So the procedure that we need to take a consent is major or minor procedure which require intrusion or penetration of the body, either through puncture or incision of the skin, or through the body natural orifice. Other examples, procedure which require insertion of a device or a foreign material. In these cases, we need to take a consent, such as percutaneous aspiration and biopsy through the skin, cardiac and vascular catheterization and stenting, endoscopy that requires sedation. Also, any procedure that required anesthesia or sedation, such as general anesthesia, local anesthesia, nerve block, also we need a consent. What about a non-surgical medical procedure? Yes, like chemotherapy, because chemotherapy may lead to change in the body structure, so that's why we need to take a consent as well. Other example, intervention medical procedure, radiotherapy, electroconvulsion, intravenous contrast injection, and also blood component therapy, such as blood transfusion. So in general rules, so any procedure that you give a detailed explanation to the patient, or if you are in doubt from the patient. So who can consent? Now I will talk about a few laws, Kuwaiti laws. So the one who can consent for himself is a patient who is fully conscious and legally competent, and who is 21 years old or above. So he has the right to say yes or no. What about the patient who is legally not competent, such as the minors, under age of 21? In these cases, we need the legal guardian to sign for him. Similarly, for those with mentally retarded or insane or lunatic, also we need the legal guardian to sign for him. Now let's talk about the minors. So we said if he's under 20 years old. So who will consent for him? His father. If the father is not available, then we'd go for the grandfather from the father's side. If the grandfather is not available, we'll go for the uncle from the father's side. If all are not available, then we need an authorization from the court. And this is according to the Articles 209, Personal Law number 51 of the Kuwaiti Law 1984. So this is the rules. This is the rules and the laws of the Kuwaiti for the minors. What they said, you will face two situations. If it's a life-saving situation, you don't need to wait for any consent. You have to proceed and give medical treatment for the patient. And this is for the minors as well as for the mentally retarded or those patients in coma. Now, what about if the patient can wait for a few hours or a few days? In this situation, you try to convince the fathers or the legal guardian to give a consent. If he insisted not to give the consent and you think that the patient needs this procedure within 24 hours or 48 hours, in this situation you will go for the public prosecution, because by law, public prosecution, they have the right to save the child and provide for him a safety environment. So also what you see in this, the last line in the Kuwaiti law, they said the legal guardian or the father has to be honest and he has to be reasonable in giving a decision. If he lost these two things, you don't need for his consent and you proceed with the treatment if you think that the child or the minors need the procedure. What about the wife? Well, no. If the wife is under 21 years old, so we'll deal with her as a minor. So you'll see to the procedure. Either it will affect her infertility or not. In this situation, you need the husband to sign for her. If the husband is not available, then we'll go to the father, grandfather, uncle of the husband, from the husband's side. If not, we need authorization from the court. Now, what about if she is more than 20 years old? In this situation, we look into the procedure, if it affects the fertility, this is the husband's right to sign for her the consent, not her. If it's not, in this situation, it is her right to sign, if it's not affecting her fertility. Okay, and this is by law. Okay, what about the guarantor or al-kafil? He has no right for any medical authorization. He's only responsible for the work and the residency in the country. So the patient has to sign for himself. What about the mother? By law, she cannot sign for her children. And in this situation, she needs an authorization either from her husband or from the court. What about non-Muslim? When their religions prohibited him from going into the procedure, you will see, if it's elective, he has the right. If it's life-saving, no, it will be the doctor's right to proceed with the procedure. In case of emergency or unknown patient, then this is we are facing during the road traffic accident. Because failure to provide an urgent procedure, it will endanger the patient's life. So in this situation, the physician has to proceed with the treatment. So either one or two consultants can sign the consent, justify this in the progress note, and they can proceed with the treatment. Now, what things that can affect taking consent? We have either patient factors or provider factors. If you see the patient, it's the low education, cognitive, confusion, feeling intimidated, stress, and the language barrier. In this situation, if we are facing the language barrier, in this situation, you can bring a translator, and he has to sign the consent. Okay? Provider, yeah, we know that lack of time, complex written, lack of support, and wrong assumption from the provider, the physician. This also affect the taking consent. How much we need to disclose to the patient? Well, it varies between patient and patient. So you can give the nature of the history, nature of the medical procedure, purpose of the procedure, important and suspicion risk. And you have to give them the alternative medical treatment. Okay? So what we mean by important suspicion risks, any temporary or permanent or serious injury or disability. Like in surgery, we have to tell the patient the rate of death, paralysis, bleeding, infection, injury to the surrounding organs, failure of the procedure, or redo surgery. Okay, so just because of time, I'll just go quickly. Now, patient threatening to himself. If you start the procedure and then patient decided not to continue in this situation, you have to continue the procedure until the patient is in a safe status. Now, if the patient refuses and the relative refuses and you think that this procedure is important, their rights will be taken away and you proceed with the treatment. Okay, so this is the penal code, Act 30. I put it in Arabic. يمكن مصادرة حق المريض أو من يحل محله قانونيا في حال رفض العلاج إذا كانت حالة المريض طارئة وتهدد حياته وتستدعي التدخل الطبي. So this is the law. Do the physician have the right to refuse the surgery if it's endangering patient life? No, because this will criminalize him in court. And he has no right to decide yes or no. He has to provide the treatment. Okay. So for how long consent will be valid? As long as the procedure is going. When its consent expired, when patient discharged, or when he withdraw his consent, or new development or new therapeutic option came out. What about for recurrent procedures, radio, chemotherapy, or repeated renal dialysis? You can take it before the procedure, and you don't need to repeat it unless there's a new development came out. So what about the physician who forgot to take a consent? If I came in the morning, I see my patient, he put in the general anesthesia, and I forgot to take the consent. In this situation, you postpone the procedure. If you want to take the consent at the same day, you have to wait for 4 to 6 hours. So it's important to postpone the procedure, and you have to document in the file. Multidisciplinary team, yes, everybody has to explain to the patient, and each one has to sign the consent. And the physician responsibility that the consent it has to be filled completely and clearly. Witness, any member of the medical staff can be witness, But you have to make sure that the witness is not the guy who is responsible for the treatment. He's only the one who will say that I witnessed that the doctor explained to the procedure to the patient. So please, if you are unsure, ask. Do not assume, because if you assume and things goes wrong, it will increase the chance of medical error, it will increase the chance of successful malpractice and litigation, and it will violate of professional ethical litigation. So what Dr. Ibrahim said, that there's a Ministerial Health Decree 307, year 2015, stated that we have to use the new consent form. And by this, you are not supposed to use the old one. So we have to use the new one. I will just show you the new one. Okay, so this is the new consent form. So this has to be filled, and this is what I talk about. Okay, so this is the new consent form. Anyway, there is a problem in the computer. Anyway, there is a new form for the consent for the general surgery. Okay, for the anesthesia. This is for the anesthesia in Arabic and in English. لجنة الجودة موجودين هناك في copy. You can take a copy from them, or you can take the original one and you do copy on it. Okay, and there is for the radiology intervention, and there is for the discharge against medical advice, and there is the refusal of the referral. So please, if you need anything, لجنة الجودة موجودين, and you can take a copy of it. And thank you very much.